Tonight, Cuyahoga County leaders are bracing for big federal changes to SNAP and Medicaid, changes that could impact thousands of local families.
Danielle Wiggins breaks down what's changing and what it could mean for people here across Northeast Ohio.
Here at the Westside Catholic Center, basic needs are met for community neighbors.
I'm looking for ways to survive.
For decades, Carmen M. Sanders, who says she lives with a disability, has relied on the Supplemental Nutrition Assistance Program, or SNAP, to get by. She's worried the new changes could hurt people who may not know the rules are shifting.
I think if people don't know any better, they're going to lose.
We're going to have to make sure that our neighbor is taken care of.
That's why County Executive Chris Ronayne and other community leaders are pushing to get the word out about those changes to SNAP and Medicaid after a new federal law passed this summer.
We're waiting for an effective date from the federal government, which we don't know when to expect it.
There are new work requirements for both SNAP and Medicaid. For SNAP, that means recipients aged 55 to 64 and parents with children 14 or older will now need to work. Exemptions for veterans, homeless individuals, and former foster youth are going away, affecting about 1,500 people in Cuyahoga County. For Medicaid, new rules are coming for those in the expansion group under the Affordable Care Act. Here in Cuyahoga County, that's about 98,000 people. They'll now have to complete 80 hours a month of work, school, or community service. Another option, earning the equivalent of 80 hours at federal minimum wage. That's about $580 a month. And instead of renewing once a year, this group will have to reapply every 6 months.
We didn't write these rules. We didn't ask for this, but it's coming into our community. And let's face it, we're going to have to step up to weather a storm ahead.
Danielle Wiggins, 3 News.